Hi, I'm Veronique at the Chronic Illness Trauma Studies. If you have a chronic illness and you have a sense that a traumatic event or a series of really difficult events triggered the onset of your chronic illness, this is actually a really common thing. And you may have heard that this is the case for some other folks, but often what you find is that it suggests that it's psychological. But what I found as a physician and looking at studies in all different kinds of chronic illnesses, autoimmune diseases, asthma, chronic fatigue, looking at my own personal experience, and with clients that I've worked with, is that it's not actually psychological. It's not in your head. And what we're starting to see in the science that's emerging is that it's really about how life events affect your genes. So if you have a chronic illness, which I'll just mark here with an asterisk, chances are there are one or maybe two places in your life where you've had a sense that you had a traumatic experience. If we go back in time, the first place would be before onset. And this may have happened as a single event. It may have been a series of events. So maybe you had a fall and broke your ankle, or you were in a car accident, or got fired from work, which you wouldn't think is traumatic. It tends to be linked to other events that have happened in the past. It may have also been that you had a whole series of really stressful experiences. Maybe you lost a family member, maybe you were a caregiver for a number of years, and then moved and had to start all over. So it can be a series of events, or it could be one single big event that triggers the onset of chronic illness. And sometimes this may have been a very short period of time. It may have been weeks, it may have been months. But sometimes these kinds of things happen in the year or 2 years before the onset. So that's one area that's actually quite common. The other place is, if we go back further in time, is actually looking at childhood. And there are all sorts of events that can happen in childhood. One of the most popular emerging scientific studies that's coming out right now are the adverse childhood experiences, or the ACE studies, ACE for adverse childhood experiences. And the ACEs are composed of actually 10 very specific questions that these scientists took a look at. They don't include everything that could possibly happen, but in those 10 types of events, some of these include things like losing a parent, experiencing physical, emotional, or sexual abuse, neglect, and it can also be having witnessed trauma. Maybe you've witnessed domestic violence. Maybe there's a family member who's experienced some other kind of trauma. So adverse childhood experiences have actually been shown to have a very significant increase in risk for chronic illness. These are the two most common areas you'll likely have a sense of if you've experienced trauma and have a sense that it may relate to your chronic illness. So what I'm going to do in this blog post area is I'm going to give you a number of links to look at on the blog for more information. And I'm also going to show you a link for different tools, because it's actually possible to heal many, if not most, of the effects of trauma, even if it happened years ago, or even if it happened decades ago in your childhood. Now, how far, to what extent we can heal our chronic illnesses, I don't know, but healing the effects of trauma can have a huge impact on your experience of your chronic illness, your symptoms, your sensitivities to stress, your flares, those kinds of things. And understanding more about trauma, working through that, is also really going to give you a context and help you understand your chronic illness. I'm also going to give you a link to ebooks. I have a number of free downloadable ebooks where you can learn more about the kind of symptoms, other symptoms that you may have that may reflect a history of trauma, and an overview of trauma and how there's a series of events that can affect risk for chronic illness as well. I hope these resources are helpful. Until next time.